name is Matt Brown. I'm a physical therapist at West Valley Medical Center. I'm here to talk to you about physical therapy as it pertains to what you're going to go through after your operation. What I'd like to start with is talking about basic precautions that things that doctors want you to avoid as much as possible. A lot of these might be obvious, but let's go through each of them. No bending at the waist, so no bending forward, like to get something off the ground or address your feet. Bend with your knees and with your hips, so practice good body mechanics. No lifting, pushing, or pulling more than 10 pounds. And 10 pounds is not very much. A gallon of milk weighs about 8 or 9 pounds, so that gives you an idea that doctors really want you to lay low and take it easy at the beginning. No twisting, so no twisting, from your waist up. If you're going to turn your whole body so that your hips and your knees, or your hips and your shoulders are aligned. No reaching, so reaching out, that puts a lot of strain on your back and could potentially cause a fall. And no straining, so don't hold your breath during any activity. Make sure you're breathing normally. And it is critical that you follow these precautions for at least 8 weeks after your operation. The doctor will give you an idea if you need to extend that, or if you're able to shorten that period of time that you're following these precautions. Pre-op exercises that are good to know how. A lot of people know how to do this already. A log roll essentially just means that when you turn over in bed from laying on your back to on your side, that your shoulders, your hips, and your knees are all turning as a unit. You don't want to turn your shoulders first and then turn your lower body, because that's twisting. That's actually two twisting. You're twisting once and then untwisting. So if your shoulders and your hips and your knees all come together rolling to your side, you'll end up in this position. So that's a good thing to practice and to learn how to do, because that's going to be how you're going to want to move after the operation as well. And then to go from side lying up to sitting, this ends up being the harder part. You want to start by bringing your legs forward so they come off the bed. You can kind of push with this hand here, get that elbow underneath you. That's about halfway up. And then you come all the way up, trying to minimize as much as possible any movement at your trunk or at your core. Okay. Pre-op exercise, the second one, I think that's a worthwhile thing. Using your arms to get up out of a chair. Sometimes people have a little bit of weakness right after their operation, and having a little extra strength in your arms will help you in and out of chairs, make that a lot easier for you. When it comes to medical equipment, it's not often that people need an assistive device, but if a physical therapist comes in to evaluate you after your operation, whether it's me or anyone else, we tend to bring a walker because we just want you to be safe. As soon as you demonstrate that you're safe and you don't need it, we'll get rid of it. But we just don't want you to get up and do one of these things and be a fall risk. So we want you to use a device just to make sure that you're safe, so you don't fall right after the operation. We can make recommendations if need be, but generally people don't need assistive devices right after their operation. Really important to walk multiple times a day after your operation to build strength and endurance. We don't want you sitting and lying down in bed for long periods of time after your operation. We want you to get up and move around safely with good mechanics, and we don't want you to fall, but it's important to mobilize frequently throughout the day as part of your recovery. Again, my name is Matt Brown, physical therapist at West Valley Medical Center. I appreciate your time and attention. I hope this was helpful.